Eliminating mother-to-child transmission of HIV and ensuring care for all persons living with HIV aligns with global best practices and the Sustainable Development Goals 2030. Nigeria's efforts over the years to reduce mother-to-child transmission of HIV have remained low.
We have 22 new infections annually, and we have 300 children dying every week from HIV, which translates into 15,000 deaths. We're failing in preventing these infants, these children that are being born with HIV. We should not be here.
As part of efforts to reduce the burden and double its efforts, the U.S. government is partnering with Nigeria to help tackle this public health threat.
The U.S. government, through the President's Emergency Plan for AIDS Relief, has invested over $8.3 billion over the last 21 years to eliminate HIV as a public health threat by 2030 here in Nigeria. And these resources have been invested in several areas to empower the girl child, deliver services, provide commodities, and achieve those goals.
The Nigerian government, in trying to reduce the 25% burden of global HIV transmission, has set up a committee headed by the Minister of State for Health, Dr. Tunji Alausa, to tackle mother-to-child transmission of HIV. This is centered around 4 pillars.
We have to monitor month-by-month improvement or the indicator being static. So we have to hold ourselves accountable. This is just not a meeting that we'll have, that we just run through numbers. We will have to see the dashboard being projected. And I'm sure you have the resources to quickly develop the dashboard, and the indicators are out there. We already know the indicator we'll be targeting. We know the benchmark that we want to meet.
Health experts suggest that accessibility to healthcare services, educating mothers and affordability of healthcare services, stopping stigmatization against persons living with HIV are key to drive home the aim of reducing pediatric HIV in Nigeria.
The government-mandated structures must be supported to lead implementation at all levels in line with the new business model and explore the multi-sectoral approach to ending HIV and AIDS among our children.
First, the mother has to be taken care of. She needs the knowledge, she needs to be well informed, she needs to be structurally stable and also have an enabling environment free of stigma and discrimination and have access to quality services. There are countries that have already succeeded, even in Africa. One of them is Botswana. And if you look at the economic strength and the power of the state, Nigeria is a great country, which if the will is there and the zeal is there, we can achieve it.
The chairperson, Nigeria Governors Spouses Forum, reaffirms the commitment of the forum to ending HIV/AIDS in each state through awareness campaigns.
We stand as veritable partners in the drive to protect our women and children and rid our country of the dreaded disease.
Nigeria needs the political will to implement health policies and initiatives. This is what the committee set up by the Nigerian government is expected to achieve. Ulije Wapera, Arise News.